Thanks. Thank you, Eve. Thank you very much for the opportunity to participate in this great session today. Thanks to Kate as well for getting us all organized, as it were. So I'm just going to share a few thoughts from the 13 or 14 months that I've been at CIHR, and in particular as it relates to two significant research files that I've been working on, which are the opioid and cannabis research files, and I've tried to place this in the context, of course, of pain research. So much of what I'm going to talk about in my first slide has, I think, already been discussed this morning. There's a significant belief, I believe, and evidence that chronic pain and managing chronic pain has a very important foundation that has contributed to the opioid crisis in the country. The numbers are staggering with the numbers of people who are currently prescribed and using opioids for their pain. This is an area that we at CIHR have been working very closely with the opioid response team to be part of developing evidence for policy and practice options that are then transmitted to the decision makers in the various provinces and territories. And the vast majority of activity in the past 12 and 13 months have really been focused on keeping people alive because of the numbers of deaths that have been escalating. I am pleased to say that while there have been, I think, significant advances made, the conversation is also shifting a little bit more between the opioid response team and CIHR, and that is also to look at how can we prevent the types of issues that have arisen that fuel the crisis, and the focus has now shifted to the beginnings of a conversation about pain. The other major area that I've also been charged with in the past 6 months is providing a research foundation to develop evidence that bridges the knowledge gaps around cannabis. And the view is that on one hand, we need to understand the potential harms associated with cannabis consumption. And by understanding the harms, we can develop, ideally, knowledge-based approaches to reduce those potential harms. But the flip side for cannabis, of course, is that there's also evidence that there are benefits associated with cannabis consumption. And I believe it was last year, the National Academies of Science in the US identified 3 areas. One of those areas is cannabis for nausea associated with cancer treatments. The second area of evidence that is reasonably strong is in the areas of spasticity associated with certain neurological disorders such as MS and Parkinson's disease. And relevant, of course, to this conversation is that there is low to moderate evidence for efficacy of cannabis or cannabinoid derivatives, specifically for neuropathic pain. Nevertheless, there is a sense that if cannabis or cannabis derivatives are going to be proposed as a generation of agents to combat various forms of pain, more evidence is needed, and in particular, there seems to be a growing interest to see whether or not, in the near term, cannabis might be considered to be able to support reducing pain and perhaps sparing opioid use amongst those who are currently prescribed opioids. So there's a lot that still needs to be known. There's a lot of research required, and I think that we at CIHR believe that more and more knowledge is required. I think that, as you've already heard today, alternatives to opioids for pain is something that we all would agree are needed and need to be not just developed from a concept perspective, but shown to be effective as alternatives to current approaches. And of course, for all those in Canada who are currently prescribed opiates, is there an opportunity to consider research and evidence-based approaches to tapering those needs for opioid consumption? One When it comes to cannabis, and I'll talk a little bit about some of the funding opportunities that might be forthcoming, one of the questions that emerges recently, of course, is there evidence for an efficacy of cannabis beyond neuropathic pain, so other types of pain? And if we're starting to see the evidence emerging, especially based on the fact that the licensed producers in this country see medical cannabis as a global opportunity, is an opportunity for the research community to collaborate effectively, to look at which strains, what types of cannabinoid derivatives, what kinds of dosages, and routes of administration. This is a rapidly, scary, rapidly evolving area that needs the research community to participate, because otherwise a lot of that research will be done by third parties and won't involve the community. And so we're looking for ways to encourage the research community to participate. So in the context of these two important Government of Canada files, we need novel ways to treat pain. And of course, what it seems to be first and foremost in the minds of decision makers is when something is working, how do you scale it up so that it can be used as a broad intervention across the country? So my last slide, 3 slides, so I listened, is so what are we doing? Clearly, as all my research colleagues would say, there's never enough money for all the research that's needed in this country. And of course, I'm sure there'll be questions to this effect later on. But I think the flip side of this is that I would argue that there are a significant number of near-term opportunities today that the research community needs to not just apply for, but almost oversubscribe. So I'm going to suggest that the pain research community in particular needs to tackle as many of these opportunities as possible to demonstrate to the Government of Canada that we have the capacity to quickly mobilize to address some of these fundamental issues. So I just listed here a couple of the opportunities that are currently open for funding. These are mostly one-year funding opportunities. And again, I'll say to my research colleagues, for those of you who think, why would I waste my time writing a 10-page grant for a one-year funding opportunity? The answer is, you're demonstrating to the Government of Canada that you recognize there's some near-term knowledge needs, and you're ready to actually put in that extra effort to try to bridge that knowledge gap. It may not be as user-friendly or effective for you, but for the Government of Canada, getting answers in a quick manner to address knowledge gaps is something that they would consider to be the community stepping up to support gaps throughout the country. The flip side of that is that there's also some very specialized opportunities. One that is forthcoming is, and I think it was just recently announced, is that in response to the opioid crisis, we've launched a one-year opportunity around evaluating current interventions for the opioid crisis. And once again, I would encourage the pain research community to take a look at that opportunity and be prepared to address it as quickly as possible, because if we're able to do some of these effectively and then transfer that knowledge as we can do to the provinces and the territories, this will demonstrate that the community is ready to mobilize its efforts towards helping the government tackle the crisis. The last thing I'll just mention is that there will be multiple multi-year funding opportunities as well that'll be forthcoming, and these will be looking at cannabis both with respect to understanding harms, reducing harms, as well as looking at its prospective medical benefit. So I hope that at least from in terms of top priorities for the Government of Canada, in the health domain, you can see where there's a significant opportunity today for the pain research community to contribute new knowledge through these mechanisms, which I think in turn will demonstrate that we both have the capacity and ability to mobilize, which will allow us to make the case for future funding for more pain research. So thanks a lot for your attention.